Hello, everyone. Welcome to Living With. I'm so excited this morning because I get to have a conversation, hopefully a three-way conversation with two wonderful colleagues of mine. That's Lindsay Jesteadt from Sleep Consortium and also Karmen Trzupek from RareX and Global Genes. So this is an unusual format for us. Normally we have a one-on-one, but we thought we'd mix it up a little bit this time and do a three-way conversation because we have some really great information and we're really very excited to share what's happening both at Sleep Consortium and RareX for our patient community. So while we just kick off, I'm going to hand it over to Karmen actually to start with, to introduce herself and tell us what she does and why she does it.
Good morning. Thank you for having me. So I'm Karmen Trzupek. I direct scientific programming for Global Genes and RareX. Some people get a little bit confused about those two. Are they the same? Are they separate? So Global Genes is an umbrella patient advocacy organization, a nonprofit. We've been around for about 17 years and really provide all kinds of services and support and education to patients and families, and even providers who support individuals with rare disorders. I came on board a couple of years ago to RareX. RareX started out as a independent nonprofit about 5 years ago. It was really founded to create a place where registry data could be collected in a new and different way that makes it far more structured and useful for research. So I was really passionate about this. I've worked as a clinical genetic counselor for over 20 years. I've worked with many families with many types of rare diseases, and the ability to get families really intimately involved in collecting their own data and making sure that the efforts they put in are valuable to the research community and used widely by the research community, just held a ton of appeal for me. And then about a year and a half ago, RareX and Global Genes merged. So now RareX is the research arm of the larger Global Genes organization.
Thanks, Karmen. Lindsay, why not? I'm sure many of our audience here are very familiar with you, Lindsay, but why not give us some context about your role as CEO of Sleep Consortium?
All right. Thank you, Claire. So I am Lindsay Jesteadt, co-founder and CEO of Sleep Consortium, which is a registered not-for-profit organization that was really created to accelerate that next generation research, disease understanding, and therapy development for those living with central disorders of hypersomnolence, as well as related diseases. So through ethical data sharing practices, leveraging AI and machine learning, we're really reimagining data collection in order to reduce diagnostic delays and improve therapeutic options and access for patients. And then I'll go ahead and give you a little bit of my why. So my why is my son, Noah. So Noah developed type 1 narcolepsy at age 4. He's now 14 years old, so he spent over 2/3 of his life battling the symptoms of narcolepsy. In fact, he doesn't remember what life was like before narcolepsy. So this diagnosis has not only shaped who he is, but it's also molded the future that he's going to have. So it was through his experiences, which are really the same type of experiences that many people with sleep disorders face, and more specifically, those with central disorders of hypersomnolence, such as those delays in diagnosis, that lack of therapeutic options, those comorbidities that aren't often discussed, let alone addressed, and so much more, that Sleep Consortium was born. So its ultimate goal was really to collaborate, to work together, to accelerate the research agenda. And Claire, I know that you have a very similar story in regards to your why. So would you like to share that?
Yeah, it's a real wonderful moment because Lindsay and I met through sort of our children. Matilda was diagnosed at the age of 3 with type 1 narcolepsy, so very similar kind of onset and trajectory as Noah. And I think, as a parent caregiver, one of the things that is such a burden is, we understand that there are sort of some treatment modalities and therapeutic options, but we live with the reality of there being so many other issues that they face daily, whether it's cognitive impact, academic impact, social relationships, and their future just looks so kind of undetermined, I suppose, with such young children on set. Of course, Matilda's now 17 and Noah's also a teenager. And I think the burden of wanting them to have as best a future as possible was something that we just couldn't really shake off. And so if there's some way in which we can contribute to accelerating research and treatment options, then it always made sense to sort of try our best and kind of fulfill that role. So. All right, so Karmen, I wonder whether you could talk to us about the RareX platform and specify how it's different to any other registry, because I think we're all pretty much familiar with the options to fill out surveys and join registries. So why is this one different, and why should people join it?
Well, I think maybe to explain how it's different, it's useful to think about why RareX got started. So, RareX was really founded out of a clear need. The founder of Global Genes, actually, Nicole Boyce, left Global Genes to found RareX. So it was really a coming back together in many ways, the merger. But she left because so many patients and parents and patient advocates were coming and really requesting something different than kind of what they were finding in registry options. And so they were coming kind of over and over again with feedback such as, well, we found this platform where we could start a registry, but the data isn't GDPR compliant, so it can't truly be global. Or we found this registry platform, which is great because it's free and they say they have international capabilities, but we don't own our data. And so they're going to decide where the data goes and how it's shared and when it's shared. And then, the flip side of that is that, you can find for-profit companies that will launch a registry for you for $2 million. The vast majority of rare disease organizations cannot do that. And if they could fund $2 million, that's not where they want to put that money, right? Mm-hmm. So how can we solve this problem? And that's really what gets us to what RareX is today and how it's different. We were founded as a nonprofit. We got started with enough philanthropic funding to sort of get this really off the ground in a way that patient communities can come together and start to collect data in a way where, number one, all data is patient owned. So each person, not the patient advocacy group, each individual who is collecting data, they own their data. Mm-hmm. And when I say they own their data, what that really means is that they tell us how they want it shared, how they don't want it shared. And if at any point they don't want it shared anymore, they can choose that too. They can come in and tell us that for whatever reason, they've decided they no longer want to participate. But the biggest reason that this is important is what it means is that the data gets used really widely. So we are not an academic medical center. We are not a for-profit research institution. We aren't doing most of the research work ourselves. We're really an enablement platform. We are collecting data. We're collecting it in a super structured way that we have worked very hard to ensure aligns with what researchers use and need. And then we share it widely with any researcher, whether that researcher be at an academic medical institution or at a biopharma company that's developing therapies. We share that data widely with any researcher with the qualifications to really use it ethically.
I think that's one of the things that was so compelling for us, that the RareX platform means that the patients own their data. That was just something that aligned with Lindsay and I kind of philosophically and ethically. And of course, you already had so many disease spaces on the platform. Mm-hmm. But Lindsay, why is it so important that Central Disorders of Hypersomnolence are on that platform?
Well, joining the Sleep Consortium sleep data collection platform, it's really important to the sleep community for several reasons. So first, by contributing their data, patients can play a crucial role in advancing research on sleep disorders. That aggregated data will allow researchers to identify patterns, understand the underlying cause of sleep disorders, and then develop more effective treatments. So this collaborative effort can lead to breakthroughs that individual studies alone may not achieve. It can also be used to help tailor treatments to individual needs. So by understanding how different patients respond to various treatments, providers can offer a more personalized care plan for the patients. So the patients are more likely to receive treatments that are effective for their specific conditions, which ultimately is going to lead to better outcomes. Third, really participation in the platform empowers patients. It gives them a voice in the research process. So they become active contributors to the knowledge base about their condition. So this involvement can be very empowering for individuals, and it really helps people to feel like they're more in control of that health journey.
Yeah.
And then obviously that overall goal is to speed up approval of new treatments. So when you're dealing with comprehensive data sets like this, researchers can provide stronger evidence for efficacy for new treatments. It can accelerate the approval process for new drugs and therapies, which then makes it available to patients much sooner.
Yeah, thanks, Lindsay. That's really important, I think, for us to understand how it does benefit patients sort of as an individual and as a family. And you touched on the research element there. Karmen, can you speak to how researchers actually access the data on the platform?
Yep. So there's actually two ways that researchers can access the data. Either one of them starts with a data access request. So it's very easy on our website, on the RareX website. If you go to the researchers tab at the top, you'll find out how to access the data, and there's a data request form there. Once we review that and put in place a data privacy agreement to ensure that the data is really being held ethically and privately, then the two different ways that they can access it are one, all of the data gets migrated over to a platform hosted by the Broad Institute. So this is actually an important step in the process because the Broad Institute is such a strong partner and they host literally hundreds of research studies. This platform is not going away. That data is extremely safe and private and will be there very long term, which is important. And that is a really powerful cloud-based computing platform. So part of the way that our data is structured is we ensure that every single data element, this is something that like someone coming onto the platform would never think about or really notice. I mean, you couldn't notice, they wouldn't know, is that every single answer to every single question becomes numeric on the back end. And so researchers, when they access that, if they're familiar with cloud-based computing methods, with AI methods, with machine learning methods, they can actually use any of those sort of techniques using the data set because it's already structured specifically for that end use in mind. On the other hand, there are a lot of clinical researchers, and I will say that I've been one for many years. Like, I took biostats at a time when you did it on pencil and paper, not using R on a computer. So it's a little overwhelming to me, this cloud-based computing platform personally. So we also work with those researchers and get it to them in a much more kind of traditional spreadsheet style so that they can compare it to, say, their own clinical database or their own natural history study if they're conducting one. And we have multiple centers like that collaborate with us where they have their own natural history study data and they're able to pull ours in and compare it.
Yeah, thank you. I think that also speaks to how the data is de-identified, which is really important for our patient community to understand that.
Yeah, I think that's right. It's interesting for individuals to know the difference between de-identification and being anonymous. Our data isn't anonymous. When people think about anonymous data, that is like, well, you've made a donation of some kind of data. So maybe in the past, like you donated blood and you agreed that your extra blood could be used for something, but they strip any identifiers of it and no one could ever trace it back to you. De-identified is different because, ultimately we know the number and we can trace it back. And that's actually really important because if the researcher wants to know, like, this is really, really interesting. If I send you back these numbers, can you tell me if there's been follow-up since? If they're analyzing some data and it takes them 6 months to do, and there's a subset they're really interested in, we can do that. So we're really keeping the data very safe while ensuring that follow-up can happen. And also ensuring that, at some point, if there is a clinical trial and people might be candidates for it, if they have told us that that's something they're interested in because that's a preference they can give, then we can contact them. But the researcher isn't going to contact them because they will not know their name, right? So there's always like a feedback loop, but one where people are protected. Yeah. I am interested, Claire, in kind of hearing your perspective on the research, because I know we've talked a little bit about different, personas of researchers. And so I think what I've been talking about is a little bit more the clinical researcher, but how do you think about this data being used to accelerate therapies, especially with industry partners?
Yeah, that's a good question. I think in Central Disorders of Hypersomnolence, and just want to clarify what that means actually at this point. So it's a fancy term that we use for basically type 1 and type 2 narcolepsy, idiopathic hypersomnia, and Klein-Levin syndrome. So that's sort of the focus of our work at Sleep Consortium alongside that of RareX at this point. So that's what CDOH means. And it's a good question because we have an incredible research community in CDOH and in sleep medicine with a global presence of researchers who are extremely dedicated to advancing the science, furthering disease understanding, but of course with a view to accelerating treatment options. And, one of the things we've found both personally and professionally is that there are some treatment options, particularly for narcolepsy, less so for IH, that are approved, and even less so for Klein-Levin syndrome. And so what we really want to do is to increase the amount of therapeutic options that all of our patient community experience. Not only that, but sort of the traditional symptoms of like whether it's excessive daytime sleepiness or disrupted nighttime sleep or cataplexy, for example. There are some options out there. But we're all very well aware that there's far more kind of symptoms and impact around living with a disease than just like the clinical list, as it were, of symptomology. So we're particularly excited to sort of work with researchers to sort of address other issues that are very significant for our patient community, say, for example, like brain fog. So I think our research community, Lindsay and I have been working with individual researchers at Sleep Consortium kind of for the last 2.5 years, working particularly on the back end of the questionnaires that we'll come to in a moment. And there's a huge kind of excitement and commitment on their part because they want to be able to access meaningful data. So, Karmen, let's start with you. If one of our patients or family member supporter wanted to hop onto the platform and join and register, what are the first steps that they need to take?
So when they first come onto the platform, and which is like easy to find directly through the Sleep Consortium website, little button right there. So when you come in, the first thing you do, of course, is create an account like anywhere. It takes longer to create an account here, I will admit, than, most sort of websites if you're just, ordering a new pair of shoes or something, because this is true research and we need to collect informed consent, and we have it out, laid out in such a way in sections to make it very understandable with extra information if you want it. So you go through the informed consent process, and then state your preferences about how you want your data shared. So once that piece is done, the very first sort of real questionnaire or survey that someone gets is what we affectionately call the head-to-toe survey. And this is a very short, very simple survey that literally has questions as simple as, do you have any problems with your vision? And then there will be a list of examples because we want to make it clear that we mean things like, optic nerve diseases, but also things like myopia and the need for glasses, right? So we'll have examples there, but it is literally that high level and simple. And that is very purposeful because we have all answered surveys where there are so many questions that do not pertain to us. And so everything that is designed within the platform is designed in such a way to ensure that it is always applicable. So if you said yes to that question, as soon as you're finished with the head to toe survey and close it out, you're going to have a vision survey in the platform. And that one's also going to be relatively short. It's going to ask high level questions like, is your vision fully correctable with glasses? Right? If it's not, that's a whole other class of conditions than if it is. So it really ensures that you answer these sort of piecemeal questions in such a way that everything is always applicable. And then you start to get to a different type of survey. So if you said, yes, I have problems with my sleep, and then you have that sleep survey waiting for you, that sleep survey will get into some of those symptoms that we've been talking about, some of the diagnoses and symptoms. If you have narcolepsy, if you have excessive daytime sleepiness, if you have insomnia, right, it'll ask these things. Once someone says yes to that, then it starts to get to what are called clinical outcome assessment measures. And these are more commonly known in the patient community as PROs, or patient-reported outcomes. These are actually highly standardized measures that are developed by researchers. And we go through a very robust process with expert advisors on which ones of those to utilize and when. And we actually have to license those measures before we can implement them on the platform. So it's a very structured process. And that data is incredibly useful to the researchers.
Mm-hmm. Yeah, I think that's helpful. Lindsay, we were sort of worried at one point, weren't we, that the kind of questionnaires would be really onerous. Can you speak to how kind of user-friendly it is for people with sleep disorders, actually?
Sure. Yeah, we were indeed very concerned initially, thinking, I filled out a lot of registries in my time, and those take a great deal of time to sit and go through, and not all of them are set up in a way that you can come back to them. So the way that the RareX platform is set up is, one, it's really a personalized approach. So all the data that's collected is relevant and detailed, and it provides really specific, valuable insights to each patient's unique situation. But with that, we understand that participants have busy lives. So they've been designed in a way that it's flexible, it's convenient to patients. So a patient can come on, they can complete the surveys at their own pace and in their own time. So if you have 5 minutes to spare, you can log on, you can look, in each of the surveys are to the right of them tells you, this should take about 3 minutes, or this one has 6 questions, it may take you 4 minutes to complete. So you can click through and just complete the ones that you have time for. And then you can easily log out and come back later when you have additional time. So that flexibility really is going to encourage more participation, but it also ensures that we're able to gather this comprehensive data from a truly diverse group of patients.
Yeah, I think there's one other thing that's important here, which is that, and Claire, you spoke to this earlier, that we also want to understand what are some of these kind of coexisting symptoms, what's often called a comorbidity, right? Another kind of condition or serious symptom that may coexist. And because, as Lindsay just said, the platform is so customized based on your responses, it'll capture that. So someone who has significant brain fog, that's going to be not only captured at a high level, but then they're going to get specific questionnaire on cognition and on sort of the daily activities of living that can be impacted by cognitive changes. And then even beyond that, like maybe there is a more rare condition affecting sleep where there are some neurological impacts that affect movement. Like these are the kind of things that, in medicine, we can't always predict. And so if you design everything in what I think of as a hypothesis-driven way, like I have a question and I'm going to answer it with this, you don't always find the answers. So sometimes you just have to let people tell you what they have.
Right. So how do you see the sleep platform kind of interacting with other disease? Because you've got lots of other disease spaces already built into the platform. Can you speak to some of those other spaces and how you think those people coming in through another disease area might be able to, I mean, we're at that's our hope, right? That they actually get led to the sleep piece and potentially find out that, yes, they have a legitimate sleep problem.
Yeah. So RareX really got started in rare pediatric neurologic disorders. Now, many of those conditions, many of those kids have sleep disorders. Most of them, honestly, are a lack of sleep. But we find that sleep disorders in general are very, very common as a coexisting condition with many rare disorders. We've since kind of brought on many rare disorders, so not just the pediatric severe neurologic disorders, but for example, there are a couple of conditions on our platform that are rare disorders of vision loss. And sometimes in those conditions, individuals can have a variety of different sleep conditions that may or may not be related to severe loss of vision that can affect your circadian rhythm. So they're going to get the same head to toe questionnaire, right? And they're going to answer yes or no to sleep. And if they say they have problems with their sleep, that next level questionnaire is really going to get at some of those symptoms and diagnoses so that we can parse out what are the ones who have insomnia, what are the ones that have circadian rhythm disorders, and what are the ones that have central disorders of hypersomnolence, and really pick up those secondary diagnoses.
Yeah, and I think that was our experience as well. One of the kind of triggering reasons that we had to kind of start Sleep Consortium is that we were connected to the parent community in sleep, but also some other disease areas where they were coming to us saying, my child has a primary diagnosis of X, but I'm pretty sure they have a sleep disorder. And, you know, we were hearing this over and over and over again, thinking, you know, we're so familiar with, you know, if you've got one diagnosis, then people kind of stop looking, doctors might stop looking, it gets super complicated, especially in pediatrics. So that all makes perfect sense. And that's also another reason why it was such great alignment between Sleep Consortium and RareX for that reason.
Yeah, I think it'll be really fascinating to see. We've already started to see just in you know, since launching with the Sleep Consortium, we've already started to see some other patient communities start to indicate two diagnoses, including sleep-related disorders. That data is very early.
Right.
But, you know, I'm particularly interested, Claire, in understanding how you think about that, given that the time to diagnosis for sleep disorders can be so long. You know, how do you think about that? What is the average time between onset of symptoms and diagnosis, and how do you think about this?
Yeah, it's long and it's varied. I mean, I think there is some data that says, you know, the average time in narcolepsy is still, you know, between onset and diagnosis might be around 8 years or more. That's sort of changing and closing a little bit. But then on the other hand, you know, we've met plenty of people in idiopathic hypersomnia who've gone 40 plus years without a diagnosis. And our experience actually as parent caregivers is that our children were diagnosed very quickly. So that's actually quite a difficult question to answer. Specifically, however, what we do know is any delay is too long. So that's very important to us that we can kind of tackle reducing diagnostic delays on this platform. And I think that's the hope, and it would be really interesting to see, especially given the fact it's so immersed in data, that it would be, I think we could see a reduction in diagnostic delays and people sort of coming to a diagnosis with a sleep disorder much sooner through the platform if they had not ever filled out their data. So that's kind of an encouragement really to those who think, you know, they've got a primary diagnosis elsewhere, they do have sleep disturbance and some sleep symptoms. So yes, let's figure that out together and reduce some of those diagnostic delays right across central disorders of hypersomnolence. So, Lindsay, Sleep Consortium's been busy this year. We'll touch on the launch of the platform in a minute, but what else has Sleep Consortium been up to?
Oh, it has been a very busy year. So this year, Sleep Consortium, actually on April 11th, we hosted an externally led patient-focused drug development meeting for idiopathic hypersomnia. And these meetings really aim to gather insights from patients as well as caregivers about the daily impacts of IH, their experiences with current treatments, as well as their unmet needs. So this input helps to inform drug developers and the FDA, guiding the creation of more effective, more patient-centered therapies and regulatory decisions. So that was hosted in April. The next piece of that will be the Voice of the Patient report, which is kind of the outcome of the meeting. That will be published in October, so be on the lookout. We also this year created patient guidelines in Central Disorders of Hypersomnolence. So what these are is they offer patient guidance and education on central disorders of hypersomnolence. So again, including narcolepsy type 1, narcolepsy type 2, idiopathic hypersomnia, and Klein-Levin syndrome. They provide a comprehensive description of each of the sleep disorders, as well as clinical presentations and symptoms. They include the diagnostic practices, treatment options, as well as resources for living your best life. They really are aimed at increasing understanding for both people living with central disorders of hypersomnolence, as well as those support networks that they have, with that ultimate goal of improved quality of life. And later in this year, we are moving forward with translating our website as well as all of our resources into multiple languages. If we are attempting to be a global organization, we need to meet people where they are. So we really saw the need for this during our PFDD meeting when our patient advocacy colleagues over in Brazil needed translation into Brazilian Portuguese for this event so that their community could participate and engage in the meeting. And it really led us to that understanding that there are a lot of communities that we're not going to be able to reach unless on our end, we ensure that we are meeting them at least with the language they speak. So our first step is to translate everything from our website to our resources into French, Brazilian Portuguese, and Spanish. And we will then move on with other languages as well. So, Karmen, what's next for RareX and Global Genes? What is on your agenda?
Yeah, well, as I heard you talking about translations, we are right on the cusp of translating the entire platform into the same three languages, actually, Spanish, Portuguese, and French. This has been, frankly, a far, far more complex process than any of us thought when we started, because it's not like translating a website. The standardized patient-reported outcome measures that I talked about before, those are all owned and licensed. And so many of those have to go through multiple rounds of translation before they can be certified and we are allowed to use them. It's been a long process, but we are right on the cusp, like within the next couple of months, of having the entire platform translated into those three languages. So that's very, very exciting. And then we'll figure out what's next in the roadmap beyond that. We're coming up on our first meeting with the FDA. So you just mentioned the patient-led drug development meeting with the FDA. The FDA has really started offering a variety of different ways that disease communities, I'll say that broadly, various individuals within communities can interact with the FDA and get feedback, provide information to them. So RareX has a meeting within the next month with the FDA. It's called a CPIM, a critical path innovation meeting. And we're really going to be talking about the RareX platform, the way that the data is collected, the way that the data is shared, and its use in regulatory applications. So this is exciting for us because what we're really looking for is guidance from the FDA on how we can think about the use of this data as it involves, for example, the design of clinical trials. Beyond that, we're going to start looking at the incorporation of other types of data. So right now, when someone comes onto the platform, they'll see that, their primary role is within the platform, is to answer surveys. That patient-reported data and getting that in a really structured and quantitative way is really important, but it is not the whole story. So we're looking at ways to get curated electronic medical health record data. That's, again, a very complex process, in large part because the medical record is a mess. There's so much in there, like just getting all of it is actually a terrible idea. You want to figure out what's really critical and get it curated and reviewed. So we're working with a couple of vendors and looking at ways to get like the really important information out of the EMR. And then we're also looking at incorporating wearable technologies and wearable data. So that would include something like, your Apple Watch or Apple Health data. And, increasingly people collect all kinds of data there. So being able to get sort of like daily data is something that could be extremely valuable in tracking progress over time. I mean, think about the ability to even track kind of your movement day to day in comparison to how significant your sleep disorder was during that period of time. Lots of growth.
It's wonderful. It's so exciting.
Yeah. I guess I'm gonna pop it back over to you, Claire, and wondering, because the two of us answered like kind of what's been going on, what's next. What about for you? What do you think?
Yeah, I think just building on the launch party webinar that we hosted with RareX back in April, and for those listening, you can go to the Sleep Consortium website and actually watch that video. So the purpose of the launch party was really pretty much like this format, just very educational. We really want Pete to get the message out there to people that this is a thing, you can access it, this is how you do it, this is why it's important. So we want to increase kind of the educational kind of piece amongst our patient community, but also continue to build relationships with our patient advocacy groups globally. So again, if you go to our website, you will see our current partners, not just industry, but also key partners are our advocacy groups. Again, some based in the US and some all over the world, actually, from Europe to Australia, to Asia, and even to Africa. So we want to kind of continue to build those relationships on a global scale. So if you want to keep up to date and keep tracking with us, do sign up for our newsletter at Sleep Consortium, again on the website, and follow us on social media. And that way you can keep up to date with all kind of progress. But in the meantime, I'd really encourage you all just to actually get started on the platform. Again, you can go to the website, it's on the homepage. There'll be a kind of flash bar that says start, log into the portal. And the other thing to say is we're going to kind of not rebrand at all, but just actually finesse some of our communications. So we've got a communication strategy working with a wonderful social media team just to make sure we're hitting all the right spaces at the right time with the right messaging. So we're pretty excited. The work continues.
It is exciting. Yeah. I'm really eager to see the engagement from the larger community, the questions and feedback that come in. We're always welcome to hearing that. So I'm really excited to work with your larger community.
Well, thank you, Karmen, for joining us. I know that we meet regularly on Zoom, and this is a slightly different platform and a slightly different conversation, but it's always good to see you. We've just enjoyed so much working with the RareX team, and I know there's so much that goes on behind the scenes with all your various departments, but we're really grateful to you on behalf of Sleep Consortium, but also the patient community for taking sleep disorders on as a really serious component to the platform. So thank you.
Thank you.